1/3 of babies are born via C-section. Here is why surgical delivery might be necessary and what to expect during and after the procedure. If you are a mom-to-be with your heart set on vaginal birth, the news that your baby needs or may need to be delivered by cesarean section might feel disappointing. Visions of childbirth, the way you have maybe dreamed, can sometimes be displaced by worries about the surgery, being stuck in the hospital longer, and the tougher recovery. And remember, the type of birth you have is secondary to the most important thing of all, a safe and healthy outcome for both you and your baby. Here is more about C-sections, including why you may need to have one, what happens during the procedure, and what you can expect during your recovery. WOMANELY. What is a C-section? A C-section or cesarean section is the surgical delivery of a baby through incision in the abdomen and uterus. A C-section is typically only recommended in medically necessary cases, such as in some high-risk pregnancies or when the baby is in the breech position and can't be flipped before labor begins. What happens during a C-section? Most hospitals strive to make a cesarean delivery as family-friendly as possible, with mom awake but appropriately numb, her partner in the room, and a chance to meet, greet, cuddle, and possibly breastfeed baby if you so choose right after delivery. If there is no medical reason not to, and because you aren't preoccupied with pushing or pain, you are often able to relax and marvel at the birth. Fortunately, this is a fast operation, with the procedure itself lasting just 10 minutes or less, followed by another 30 minutes or so to stitch you back up. Whether it's a scheduled surgery or a last-minute decision, the typical C-section is straightforward and follows tightly scripted game plan. Here is a play-by-play of what you can expect. Preparation and anesthesia. A C-section begins with a routine IV and anesthesia, usually an epidural or spinal block, so the lower half of your body will be numb but you will stay awake. Then you will be prepared by having your abdomen shaved if necessary and washed with an antiseptic solution. The operating room staff will insert a catheter into your bladder and place sterile wraps over your tummy. Your birthing coach or partner will be outfitted in sterile garb and allowed to sit near your head and hold your hand. The emergency room staff will place a short screen blocking your vision of your abdomen so the field remains sterile, and so you don't have to watch yourself getting cut. If you are opting for a gentle C-section, the drape will be cleared. Otherwise, you can also ask for a mirror to watch. Even if you don't want to see the cut, you may want to catch a glimpse of your baby as she emerges. So ask your practitioner to lift the little cutie up for a quick peek after delivery. If you are having an emergency C-section, there might not be time to numb you, in which case, unfortunately this is rarely the case, you will completely conked out with general anesthesia for the duration of the procedure. When you wake up, you may feel groggy, disoriented, and possibly queasy. You also may have a sore throat from the endotracheal tube that was inserted during surgery. It's unlikely that you will feel any pain during the procedure, apart from a bit of tugging or pressure as the baby is removed. You will be numb from the waist down if you have been given a regional anesthetic, which means you will be awake during the operation and when your baby emerges. Incision and delivery. Once you are either totally numb or fully asleep, the doctor will make a small incision in your lower abdomen. It may feel like your skin is being unzipped just above your pubic hairline. With some neat suturing, the scar should be fairly unnoticeable and will fade more and more over time. Your doctor will then make another incision in the lower part of your uterus. Next, the amniotic fluid will be suctioned out, and right after that your baby will be brought into the world. Because the excess mucus in her respiratory tract wasn't squeezed out during a journey through the birth canal, some extra suctioning is needed to clear those little lungs before you hear that first cry. Meeting your baby. After the umbilical cord is cut, the surgeon will remove your placenta and quickly do a routine check of your reproductive organs. Then, you'll be stitched up with absorbable stitches in your uterus, the kind that won't later need to be removed, and either stitches or staples on the abdominal incision. You may receive IV antibiotics to minimize infection risk, and oxytocin to control bleeding and help contract the uterus. Your blood pressure, pulse rate, rate of breathing, and amount of bleeding will be checked regularly. And then you will probably have time to get to know the newest person in your life. Although it'll be hard to keep from taking charge at home, remember to be kind to yourself and when you can, relax. In a matter of weeks, you'll be well on your way to full steam ahead mommyhood.